The state of American health, a nation at a crossroads. The health of the American population has become a growing concern over the past few decades. Despite being one of the wealthiest countries in the world and spending more on healthcare per capita than any other nation, the United States continues to face serious health challenges that affect millions of its citizens. From chronic diseases and obesity to mental health and healthcare accessibility, America is at a crossroads where urgent action is required to improve public health outcomes. 1. Chronic diseases on the rise. Chronic diseases, such as heart disease, diabetes, and cancer, remain the leading causes of death and disability in the United States. According to the Centers for Disease Control and Prevention, CDC, 6 in 10 adults in the U.S. have a chronic disease, and 4 in 10 have 2 or more. These conditions are not only responsible for a high number of deaths, but also significantly reduce the quality of life and contribute to skyrocketing healthcare costs. Many chronic illnesses are linked to preventable risk factors such as poor diet, lack of physical activity, smoking, and excessive alcohol use. In a culture that often promotes convenience and fast food, maintaining a healthy lifestyle has become increasingly difficult for many Americans. 2. The obesity epidemic. Obesity is one of the most alarming health issues facing the United States. As of 2023, over 42% of American adults were classified as obese. Childhood obesity is also on the rise, with approximately 20% of children and adolescents affected. Obesity increases the risk of many serious health problems, including type 2 diabetes, heart disease, stroke, and certain types of cancer. Sedentary lifestyles, processed foods, and high-calorie diets contribute to this growing epidemic, while awareness campaigns and public health initiatives have aimed to reduce obesity rates. The problem remains widespread and deeply rooted in American society. 3. Mental health crisis. Mental health has emerged as a critical concern in the U.S., particularly in the wake of the COVID-19 pandemic. Anxiety, depression, and substance abuse have surged, especially among young adults and teenagers. Suicide rates have increased over the past 2 decades, and access to mental health services remains limited for many individuals. Stigma surrounding mental illness, high costs of therapy, and a shortage of mental health professionals have hindered progress in addressing this crisis. Efforts are being made to expand telehealth services and integrate mental health into primary care, but much more needs to be done. 4. Disparities in healthcare access. One of the most glaring issues in the American healthcare system is the unequal access to care. While some Americans enjoy comprehensive insurance and access to top-tier medical services, others, especially those in low-income or rural communities, struggle to receive even basic health care. Racial and ethnic minorities also face systemic barriers that contribute to worse health outcomes. For example, Black and Hispanic Americans have higher rates of chronic diseases and lower life expectancy than white Americans. Language barriers, lack of insurance, and institutional racism further exacerbate these disparities. 5. High healthcare costs. The United States spends more on healthcare than any other developed country. Yet this investment does not always translate to better health outcomes. Prescription drug prices are among the highest in the world, and medical bills are a leading cause of personal bankruptcy. Even insured individuals often face high deductibles, co-payments, and out-of-pocket expenses that deter them from seeking timely care. This financial burden forces many Americans to delay or forego treatment, leading to worse health conditions and higher long-term costs. 6. Aging population. As the U.S. population ages, the healthcare system is bracing for additional strain. Older adults are more likely to suffer from multiple chronic conditions and require long-term care. The demand for geriatric specialists, home care services, and elder-friendly infrastructure is expected to increase dramatically over the next decade. The aging population also places pressure on Medicare and other public health programs, raising questions about sustainability and reform in the years ahead. 7. The role of lifestyle and environment. Health is influenced not just by genetics and medical care, but also by lifestyle choices and environmental factors. Many Americans live in environments that do not support healthy living. Food deserts, lack of safe outdoor spaces, and long commutes all contribute to unhealthy habits. Stress, work-life imbalance, and digital overload also take a toll on physical and mental health. Public policies and urban planning need to prioritize walkable neighborhoods, green spaces, and access to nutritious foods if America hopes to shift toward a healthier future. 8. Toward a healthier nation. Addressing America's health issues requires a multifaceted approach that goes beyond healthcare alone. Education, public policy, corporate responsibility, and community support all play vital roles in shaping the nation's health. Encouraging preventative care, expanding access to mental health services, reducing the cost of prescription drugs, and eliminating health disparities should be top priorities. Investments in early childhood health, school nutrition programs, and workplace wellness initiatives can also yield long-term benefits. Ultimately, improving American health is not just a matter of policy. It's a cultural shift that values well-being, equity, and compassion. The road ahead is challenging, but with concerted effort, the United States has the potential to reverse its health decline and build a more vibrant, healthy future for all.